Everyone, and welcome to the special live radio show with Dr. Doug Thompson. With over 25 years' experience in state-of-the-art oral health, Dr. Thompson will be talking to us about the serious connection between gum disease and most of the major diseases of our time. He'll tell us about where his research has led him with respect to avoiding these silent killers. He's joining us tonight in this rare opportunity to call in and speak with the doctor directly. You won't want to miss what he has to say, and if you have a question for the doctor, we're inviting you to call in at 800-859-0957. So stay tuned, and we'll be right back after this short break. You're listening to News Talk 760 WJR. We're off now. We're on Facebook Live. The music seemed to outlast us.
The clock was frozen too.
The clock was frozen? Did you tell him?
Look at it's not, yeah.
Is it not working anymore?
I don't. He's plugging it in.
Oh, he's working it? Okay. Well, anyway, Dr. Thompson, we're on Facebook Live.
Great.
So you are going to be talking about a bunch of serious stuff tonight. Sleep apnea, oral cancers, GERD reflux disease, and the wellness dentistry concept, right?
Yes, that's correct. Yeah,
go ahead.
Yeah, the whole wellness dentistry concept is that certain dentists have become very aware that oral conditions in the mouth can have a significant impact on systemic health. So what we've been trying to do is figure out what questions could we ask, what symptoms could we see, what could we gain from doing a simple oral evaluation, and how could we learn that maybe the patient has a risk in some of these other areas. And so what I would say to our listening audience is that any dentists that have a keen awareness about oral conditions and how they affect systemic health, they could really, really save somebody's life. They could help somebody in significant ways become healthier, but they have to know what to look for.
It's kind of interesting because when you start up with a dentist, I'm imagining that you fill out a health inventory about what you're suffering from, what diseases you might have, what medical situations you already have. And I'm wondering, do a lot of dentists really pay a lot of attention to that other than maybe what medications you're on? Do they really look at it?
Well, it's a twofold question because not only do some patients or some dentists really look at it seriously, but some dentists don't look at it seriously, but likewise, some patients don't take it seriously. You have no idea how many people just put a straight line through the health questionnaire and they check all no's and they say, well, why does my dentist need to know? Why does my dentist need to know about oral health conditions? That's part of the problem as well.
We're back on the air. Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne-Marie Cronin, and we're here tonight talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us talking about a state-of-the-art clinic and the latest diagnostic systems in oral health care. He'll also emphasize the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, welcome to the show. But before we start asking you questions, Ashley, you have a caller?
Yes, we have Greg calling from Shelby. Greg, what's your question?
Hey, good evening, you guys, Mr. Positive. Got to ask you, doctor, mouthwash, does it work or does it create more bacteria because the mouthwash dries your mouth? I use it regularly, but I've been hearing differences of opinion as to if mouthwash is really, really good or it doesn't really help or it maybe hinders and hurts you. What say you, my friend?
Oh, boy, Greg, you're opening up a big can of worms here. But mouthwashes can be very helpful, but one of the things that you want to really, really be careful of is the pH or the acidity of the mouthwashes. And most mouthwashes have preservatives or alcohol in them that make them very low pH. And so what they can do is they actually erode the teeth, and they can create an environment in the mouth that creates a nice growing situation for harmful bacteria. So even though they will have an initial kill-off effect, the acidity effect maybe might last even longer than the kill-off effect. So we have to be very careful about why we use a mouthwash and what kind of mouthwash we use. So if anybody has a healthy mouth, if your mouth is perfectly healthy, there's no reason why you need mouthwash. If you want to have a fresher breath, then get a mint, get some gum, do something different. But if you have a disease or you have a imbalance in the bacteria in your mouth, then we would very specifically prescribe a mouthwash that's pH balanced, and it would target the particular infection or the particular situation that you have in your mouth. Most of the commercial mouthwashes are made for fresher breath, and they are very acidic. So in our practice, we teach patients about which mouthwashes they should use and shouldn't use, and then we would do a careful evaluation and figure out whether it's good or bad for you. So the drying effect, the lingering effects of the things about mouthwash that aren't great typically have to do with the acidity of the mouthwash. And there's all kinds of mouthwashes out there, chlorine-based mouthwashes, essential oil-based mouthwashes, lots of different mouthwashes. It's a great question, but I could talk for an hour on mouthwashes.
No, it's an interesting question for sure. And as he was talking and asking the question and you're answering it, I didn't realize this wealth of information because we're so inundated in this country by advertising on TV. So it's basically what we see, what gets advertised the most on TV. I don't really recall any dentist ever saying, oh, you should use this mouthwash instead of that one, or how to use mouthwash, or how often to use it, good, bad, or ugly. It's like you're sort of left on your own to look in the drugstore shelves and go with what you see advertised on television. So, I mean, it's really important what you're doing because obviously it was a good question, and it's, it's all about education, about knowing, how to take care of your health, which is basically your bailiwick. As also in being a dentist, you're also in oral health, medicine, welfare. And tell us a little bit about your practice before we have to go to break.
Well, one of the things is we really focus on the wellness concept in practice. And so if you thought about what wellness dentistry is, it's really dentists that have a real significant keen awareness about how oral conditions, certain oral conditions affect systemic health. I mean, we're up to 57 related diseases now to just bacteria that cause gum disease and cavities. And then what maybe Mark was alluding to is that when you have acid problems, whether it be gastrointestinal reflux disease, GERD, we know that as, if you have that kind of problem, there's other things that we would want to recommend or we would want to educate you about because some things you could be doing that you think are healthy are harmful, and we don't want that for you. So,
but that's pretty amazing. That's the thrust of your practice is all about not only oral health but systemic health, because we know that so many infections in the oral cavity are responsible for over 50 diseases. And, all this information is coming out now, and they're preventative. You can prevent many of these diseases through just taking care of killing the bacteria that's in your mouth. But who knows? It's not something that's talked about. And I think very few dentists are doing what you're doing.
Well, that's what we're on the campaign for. We want to not only educate consumers and people to let them know what's out there, but we want to educate dentists as well. And that's the function of the Wellness Dentistry Network. But aside of that, what the wellness concept is just that. It's educating patients about what's harmful and what's not harmful, looking at oral conditions, and we get really tipped off as to what things we need to talk to them about. And it's specific for each person. Everybody's different, and everybody has their own unique set of circumstances. We've taken people that have had a big bacterial imbalance over 10 years ago, altered the bacteria balance back to health for them, and then we've monitored them on a yearly basis over 10 years, and they've never been exposed to the dangerous bacteria that they were exposed to or that they had in the beginning, and that's really wellness dentistry. We want to change people's oral microbiota. That's what we call that. It's basically the bugs that live in your mouth. We want to make sure there's nothing harmful in there, and if we can do that and assure you of that and measure that on a yearly basis, people can become very confident that they can avoid the ravages of heart disease, Alzheimer's disease, diabetes, lots of things that have a bidirectional relationship with gum disease.
Everybody needs to know about that. It's very interesting. In the meantime, we're going to have to come back and talk about that on the other side of the break. You're listening to the Dr. Thompson Radio Show. Dr. Thompson's here with us talking about the seriousness of undetected oral pathogens, which can be the root cause of many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR. And we are back with Facebook Live. So that was, it's pretty interesting thinking about it. Just the question that came in about what about mouthwashes? I don't remember any dentist. Do you ever telling you this is the mouthwash you should use, Ashley?
No, never.
I mean, they just leave that up to you. And I think that a lot of dentists think that every dentist out there is doing what you're doing, not to the extent that you're doing it, but telling you about mouthwashes and what you need to know and how to sort of take care of your oral health.
Yeah, I think obviously the Listerine company or whatever company.
They've got all the money in the advertising.
Whatever money, whatever company that is, they've done a brilliant job at letting people know. And you have no idea how many people come into my office on a daily basis, say, yeah, I rinse with Listerine every morning. And then they have severe acid erosion on the teeth.
But that's because once they're sold on advertising works until you've got the person in with you, and then you start taking something and use it for life. Right. It's like the makeup and the cosmetic industry. It's the same thing. Estee Lauder roped everybody in, and they stay with her for forever, and don't look at something else.
And it's understandable why people would do that. I mean, they like the product, they like the way their mouth feels after it, and there's no question there's some benefit from it. But there also could be some harm from it. So the important piece is to get evaluated and figure out, who am I? Am I the one who's harmed by it, or am I the one who's helped by it? And if your mouth is healthy, again, as I said on the air, you don't really need a mouthwash. You could use a gum or a mint if you want fresher breath, but you don't need to alter the bacteria that are in your mouth if it's healthy. If it's unhealthy, you better alter it, but you're not going to do it with just a mouthwash. That's where you need professional care, where you're going to need some kind of mechanical methodology to remove it. You're going to need you're going to need some harsh antimicrobials. You're going to need other things.
And everybody's oral cavity, as you were saying in the first segment, is different. So just because one person has this, density of bacteria doesn't mean that everybody's got the same density or the same number of pathogens or the same type of pathogens in the mouth. So it's like you have to have this test done. You don't have any other choice.
No, it's very different. We have simple saliva swish and spit test today, 30 seconds. You can swish and spit, inexpensive, and you can find out what the microbial load is or what your mouth's made up of. And we have some people who are really struggling with health, and we find out, their spouses has a lot of bacteria. Maybe has a lot of disease. So you're getting it transmitted to you from somebody else. And so, again, you're not going to take care of it with a mouthwash. You have to have some kind of professional assessment or a swish and spit test assessment, and you can find out.
So it's pretty relatively easy, this swish and spit.
Easy.
It's like, and then when do you find the identification of it? When do you look at it on a...
Yep, a week later.
I think we're back on online now. 2 minutes. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, please call us at 800-859-0957. Coming back, Dr. Thompson, we were talking on Facebook Live and over the break about we don't even know what mouthwashes to use. But tell us a little bit more about what else you do in your office when a new patient comes in.
Yeah, when we have a new patient come in the office, we start to obviously look at the health history and the dental history, and we evaluate where they might be at risk for certain dental diseases. And then when we actually get a chance to look into the mouth, then we can look at the condition of the gum health. We can look at the condition of the tooth structure, whether they have problems from cavities or mechanical or certain weaknesses of the teeth. And we can make a determination of why that's happening. And if they have any kind of bacteria imbalance that causes either gum disease or cavities, then we want to be really, really strategic about getting a sampling of the saliva and then giving them a plan of how we can rid them or create stability from those bad bacteria. So we do that, and in addition to that, we work with physicians that help the patients get healthier, because we sometimes are the frontline people that see them, and we can help them determine if they have hypertension or if they have diabetes, or if they have some conditions that are even leading them down that pathway. And the biggest one is heart disease and Alzheimer's disease. So we want to really make sure that we can help our patients understand whether they're at high risk for those diseases or whether they're at low risk for those diseases from issues in their mouth. That's the idea.
And the problem is that no one knows about this, or very few people know about it. And certainly you're sort of connecting the dots. So you're almost the forerunner to the medical profession, because most doctors are not looking at what bacteria is in your mouth. And we know for sure that the bacteria that causes Alzheimer's starts in the mouth, is found in the mouth. And we know that many others, certainly it's a big contributor to heart disease and many other systemic diseases. But if nobody's looking in your mouth, you don't just go into the dentist to see, oh, I need a filling, or I need a root canal, or I've got a broken tooth. I mean, what you're doing is taking a step back and starting off from a medicinal point of view to let's look at what diseases, what pathogens are in the mouth, so that they're either going in one direction to see a medical doctor, which they'll do in adjunct to also seeing you for their dental needs. Ashley, you have a caller waiting?
Yes, we have Jimmy from Royal Oak. Jimmy, what's your question?
Yeah, so I have two questions there. One is, I lost a lot of the gum tissue in between my teeth, and I notice I get a lot of food impacted, and it's just a nuisance to clean, to have constantly floss all the time. I was told I probably damaged my gums. That's why I have these little large spaces in between my teeth now. And I was wondering, is it safe to rinse with hydrogen peroxide? Someone said that possibly could damage my gums also.
Yeah, Jimmy, those are great questions, but if you have any spaces between your teeth where the pink gum tissue has gone away or shrunken down between the teeth, or if you have any flaring teeth or loose teeth or teeth that are getting crooked over time, that's a sign that there's a gum disease problem typically. And what's happening is the bone that holds the teeth in place is being eroded away from your body's reaction to some bacteria. So what you would want to do is you would want to evaluate what bacteria is causing that problem and how could you get that to stop, because that will continue to go on. It's thought of as a chronic disease, which means it doesn't just go away. You have to do something specific to make it go away. And one of the problems with what you just mentioned with hydrogen peroxide rinse is it's a very low, it doesn't have that much power. It's a low horsepower rinse. So any of our patients that have gum disease, that have this kind of concern that you have, and I sympathize with you, when you have these spaces, they're not only harder to clean, but they're a little bit unsightly. And Jimmy, I want to make sure you realize it's not your fault that you have those spaces. You don't have those spaces because you're a bad brusher. You have those spaces because there's a certain bacteria in your mouth that you have that's causing your body to react, and it's eating the bone away between your teeth. And the gum tissue follows the bone, just like a dent in an orange. If you have an orange and you see that dent in the orange, I can guarantee you if there's a dent in the orange, there's no orange under the peel. That's what happens. And that's the same thing that happens with your gum tissue. And so that's what's happening. And it happens slowly over time, years. It takes years to happen. For some people, it goes very rapidly. Most people, it takes years. So the answer to your question is there's things you can do to fill in those spaces. It's not easy. You can never grow the pink tissue back, typically. You have to just do something different with the teeth. But my objective in practice for you is not only to stop the infection that eats the bone away, but I would love to make sure that the bacteria that you have isn't also affecting your heart, your brain, and other areas of your body.
Jimmy, thanks for calling. He's got a lot to look into, certainly, Dr. Thompson. We've got some more callers. Ashley?
Yes, we have Melissa calling from Detroit. Melissa, what's your question?
Hi, Dr. Thompson. You talk about gum disease and how by looking at the state of someone's gum, you can see how it might attribute to other issues. When looking at someone's mouth, can you tell that they're like a mouth sleeper or grind their teeth or have sleep apnea? And, do you guys do anything for that?
Yeah, Melissa, that's an excellent question. We can look at structural issues in the mouth like a tongue tie, wear on the teeth. We can look at scalloping in the tongue. If you simply, Melissa, take your tongue out and just gently look in the mirror. If you have divots in the side of your tongue, that means you're probably pushing your tongue against your teeth in your sleep. And there's 70% of those people have snoring, and many of those people have sleep apnea. We have a very simple wristwatch screening device that it's inexpensive. You can wear it overnight, and it will give you a whole lot of metrics about your sleep. Metrics means measurables or data about your sleep that will allow us to tell if you have breathing problems, airway problems. And Melissa, not only are we worried about adults that might have those kinds of problems, but what about our kiddos? What about these little kids that are 3 to 7 years old that are making sleeping sounds? It's not normal. And if you have these little children, grandchildren, cousins, nieces, they need to be evaluated because we can help direct the growth and development of those people so they don't end up with sleep apnea. Nobody wants to be on a CPAP machine when they're older. We can prevent that if we can get to them earlier. So Melissa, your question is a great question, and yes, the answer is yes. There's a lot we can do and a lot we can see.
Nobody wants to have a CPAP machine ever, I have to tell you. And most people don't like going and spending the night being looked at through a glass window all night long and sleeping wired up to everything. And then a lot of people that do get the CPAP machine, cumbersome, a lot of people get rid of it. They toss it out. They don't follow through. So we do need to talk more about what you're doing, which is very innovative because they just take a little gadget home, sleep with it in their own bed, and then you're able to analyze the data. And so I think that is a huge advantage. And then when we come back, we don't have time to go into it right now, but when we come back, we'll certainly talk more about how that works and what the procedure is after you analyze their data. And I know that we have another caller. Ashley, do you want to tell me who's calling? We'll maybe have time.
Yes, we have Tom calling. Tom, what's your question?
Hi, Dr. Thompson. I've been dealing with anxiety for a while now and some depression, and I've a lot of brain fog. And my concern is of like early dementia. I'm 67, dementia or onset of Alzheimer's. Trouble concentrating. My mood has changed, and I'm not my people person self for the last year or so. You mentioned the possibly causing the Alzheimer's. My question is, how connected could this be?
Yeah, Tom, it's a brilliant question. I want to address it a little bit more when we come back after the break, but I love your question, and it's very relevant. And Tom, I want to assure you, you're not alone. There's a lot of people that have had anxiety and stress issues, especially during these last couple of years, and many people are realizing they're just not as sharp or they're just not where they want to be. So when we come back from the break, I'd love to help you with that question.
Talk more about it. In the meantime, you are listening to the Dr. Doug Thompson radio show, and we are talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call and talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR. Back on Facebook.
So, Anne-Marie,
Good questions. They're great questions.
And I want to let Tom know, when I get back.
When you come back, we'll pick it up.
When I come back from the break, I want to let Tom know that, and I know I think he said he was 67.
67,
Yeah, so there's still things he can do. I mean, look, we should have a vibrant life until maybe 100.
Right.
We're hardwired to live to 120. So if we don't make it that far, then something's maybe not right. So what I'd like to do is just talk to Tom and let him know that there's still a lot he can do. Right. And if he has a problem in his mouth, that could be fixed, but we could also get him to some physicians that could help him reverse or stabilize the brain fog. And maybe there's many other things. He could have mold in his house. He could have other conditions that are causing that for him. So his environment needs to be evaluated very carefully, and his oral health needs to be evaluated very carefully. So there's lots we could do for him.
I think one of the problems is that people are so dependent on their primary care physician, which is basically giving you 4 to 5 minutes of time. You're now lucky after COVID if you can get in. It's very hard to get in to see, even to get in to see a specialist, you're waiting a long time.
Yeah.
And I think there's so many failed diagnoses in primary care that are just falling through the cracks, and that he's not alone out there.
He's totally not alone. And, 20% of the patients see us more regularly than they see their physician. So if you happen to land on a dentist that understands this process and understands this whole idea, it can be life-changing for sure. Because we can identify some of these situations that can guide the patient to either a different practitioner that can help them, a physician, or somebody else that can help them, a lipidologist. There's different specialties that will help depending upon what their needs are. They need to be assessed, and they need.
So when you do these tests, these diagnostic tests of the saliva and the bacteria in the mouth, when you're able to identify the person is at risk for this, are you then referring them out to certain medical doctors? Oh, that's great.
Absolutely. And you have somebody very special in we have people in our community, but you have somebody very special that's near and dear to WJR and Dr. Colander, and that's what he does. I mean,
exactly.
And Brian and I'm not going to be ashamed or afraid to say that we share patients back and forth. And, we need people who can evaluate the patients in their own area of expertise comprehensively. That's what we need to do.
Well, he's one of the few doctors, since you brought up his name, he's one of the few doctors out there that specialize in the prevention of disease. So he's heavily invested in what are the diagnostic tests that are coming out and all this information. Just a quick question. How long have we known about Alzheimer's originating in the mouth? How long has that story been out?
It's been out now for over 10 years.
Oh, my.
Well over 10 years. But we have, Dale Bredesen wrote that book a long time ago, and Brad Bale and Amy Donini wrote Beat the Heart Attack Gene, which that was done years ago, 2014, I think. So it's been around for a long time, and it's just unfortunate that it's not broader accepted and studied and known. And one of the problems is that it's it's education heavy. We have to spend time educating people. And, we get paid for drilling on things. We don't get paid for educating. That's the problem. And so
that's a big problem.
You have to have a passion for it. And I do.
And well, we're very fortunate that you do, because as we talked earlier, most dentists don't even advise what mouthwash to use. So we're kind of all in trouble as far as that goes.
We'll sort them out.
We'll come back. We're on segment 4. Welcome back to the special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Doug Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here tonight explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases, from cardiac disease to Alzheimer's, that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, we have so much to discuss. I don't know where to start, but I'm very interested in your sleep apnea test, because I do know that the CPAP, stay overnight in the hospital or in a clinic, that has become very cumbersome. And I've known a lot of people who got the CPAP machine and tossed it after 3 months. So you've got a gadget that you take home. What happens after they come back with the gadget the next day?
Yep. I want to address that question, Anne-Marie, but first I need to give Tom a little bit.
You've got to come back to Tom.
I want to come back to Tom.
Absolutely.
And Tom, I appreciate your question. I appreciate anybody who calls in to ask a question. It's not very common to talk to a dentist over the phone, but I really appreciate anybody that would do that. Tom, again, as I was reassuring you that you're not alone, but for people who are having brain fog and people who are having these kinds of issues where you think that you're worried about your cognitive health, meaning your awareness. One of the things I would want to reassure you about, Tom, is it's common for all of us to forget someone's name or forget where we left the car keys, but it's not common for us to forget what the car keys are for. So what I want you to think about is, you need to be assessed. And if you have an oral problem where there's bacterial imbalance in your mouth, that could be affecting it, but there could be other things as well. So what I would beg you to do is come in and get a thorough assessment, and let's figure out where you can make changes in your health that would minimize that brain fog. I mean, you could even have mold in your house. Many different things could cause that. So I want to address the question, but it's a very complex one. So thank you for that question. And then Anne-Marie, on your concept of sleep apnea. As allude to Melissa's call from Detroit, there's structural things that we can see in the mouth. So if you're in the office, we can see things for sure that would tip us off that maybe you have a sleep breathing problem. If you had a sleep breathing problem, the first thing I would want to do is I would want to try to measure it. And so what we have is a wristwatch type device that you hook up to your iPhone, and you take it home and you will sleep with it for the night. And it gives us some metrics about how your heart rate is, your respiration, how many times you stop breathing for more than 10 seconds in the nighttime. And if you're out there and you're a listener that's sleeping next to somebody, or you yourself has either woken up gasping, or you hear somebody gasping or snoring or struggling for breath, that's not normal. That means there's an airway issue. When you have an airway issue, what happens is you have less oxygen to service your brain. You have less oxygen, which is a critical piece that we all need to service your body, and your health starts to degrade slowly over time. And you get tiredness, you get irritability, you get a whole host of diseases and medical issues from that. So we like for people to wear this medical device. We could even ship it over the mail for people. And we'd like them to wear this piece. It's less than $300, and they could wear this piece, and it could tell us a lot about their sleep. The next thing is, what do we do about it? And for many people, there's simple things we could do, like sealing our lips at night if you're a mouth breather, or like wearing a simple mouth device, or maybe you have to go to a CPAP machine. But you could let us help you tell you what to do. We would be happy to do that for you.
And the other thing that's pretty amazing that you've mentioned is that I didn't even know it existed, pediatric sleep apnea. Yeah. Most people put their kids in a bedroom, close the door, say goodnight, and nobody's watching over them when they're in their own room or their own crib. And I just didn't even think that pediatric sleep apnea existed.
It's a huge thing. And if you ever want to do something really valuable for your kiddo, you take a small video, and I mean a very tasteful video of them sleeping at night. And if they have a unique posture, if they have their mouth open, if they're making sleeping sounds, if they're grinding their teeth, there's many things. If they're wetting the bed after they're potty trained, I mean, these are things that are warning signs that your child has a sleeping problem. And it would be good to get them to somebody who can understand that and help direct them to get the proper growth and development to make that go away.
I mean, that's a whole entire show by itself, and I'm just amazed by the fact that this even exists, and I don't know of any pediatrician that's ever talked about it to me, for sure, or even mentioned it, and I'm in the medical journalistic business. But before we go any further, Ashley, you have another caller?
Yes, we have Jim calling from Chelsea. Jim, what's your question?
My question is two parts. One is, does the mouth bacteria cause Crohn's disease?
Yeah, Jim, the mouth bacteria have what we call a bidirectional relationship with Crohn's. So to say cause is a little bit hard. I don't know that I could say cause, but I can tell you this. If you have mouth bacteria imbalance and you have the wrong type in your mouth, it can definitely cause changes in the artery walls. You have 60,000 miles of arteries that go through your whole body, and I can guarantee you that it's making changes in the wall of your artery. And there's certain biomarkers, there's certain things we can measure inexpensively that will tell us if your arteries are changing. So Crohn's disease or irritable bowel syndrome or many of the GI issues can definitely be affected by certain membranes that run through the body. So the answer is yes, but I don't know that I could go out so far and say it's an absolute total, that it's the only cause. I think the irritable bowel is a multifactorial disease. It needs to be assessed to figure out if the mouth bacteria play a role or don't play a role. My job as a dentist and as a wellness dentistry concerned dentist is to make sure that I can take the mouth off the table as being a contributor. That's my obligation to you, and I can guarantee you when you come in, I would say to you, your mouth is not contributing in a negative way to your irritable bowel syndrome. And then we got to get the right help to figure out what else could be contributing.
So when, Dr. Thompson, someone comes into your practice, a new patient comes in, are you automatically doing these diagnostic tests with everybody that comes in?
No, one of the mantras in our practice, Anne Marie, is we want to provide everything you need and nothing you don't. So the idea is we look at your health history and we look at you look at the information you tell us, then we look at the information we see, and then we make those determinations at what tests would be appropriate for you and what tests would be most warranted. What I do think as a general screening, I think we're getting to a time, and I'm at the time in my practice where I think almost all new patients should have a baseline bacterial assay, because even if they don't know that something's wrong, because sometimes they just don't know they have an underlying problem. If they have the wrong kind of bacteria, I can almost assure you that it's contributing to a potential underlying problem.
I almost feel as though you can't miss by getting this diagnostic test, no matter who you are, because with the CDC figures of 700,000 people dying of heart attack, when we've got the capability through medtech and through this type of diagnostic procedures that you have, why not just screen everybody?
Well, it's a great question, and it's just a matter of finances. I mean, some people don't want to pay for it. Some people, insurance companies don't pay for it, but there's no question. These tests are under $400, and some are tests have some tests that can be under $200. So these are not. It's a huge expense for some people. For a lot of us, it's something that we would trade that night out at a restaurant, and we would trade that. We would trade that whatever it is we do. We do a lot of cool things, and so we would give up one of those things once a month to learn something valuable about our health.
I mean, I just think it's an imperative test for everyone to get, because we're not getting. The number of people dying from heart disease in this country is getting bigger every year. The year before it was 650,000. Now it's 700,000. Who knows what it's going to be this year?
Every 35 to 40 seconds, somebody dies unexpectedly, and it shouldn't happen. 50% of women, 64% or 64% of women, 50% of men who die suddenly from a heart attack or a stroke have no warning sign, no idea.
Right.
And I can tell you, we can figure out who some of those people could be in our practice.
Oh, that's fantastic. Anyway, in the meantime, we're going to have to take a quick break. You are listening to the Dr. Douglas Thompson radio show, and we are talking about oral health and disease prevention. If you have a question, you can reach out to the doctor by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR. So we have one more segment left. It flies by fast. There's so many things to talk about. And,
many things.
You get these callers and you just feel, it's amazing that you can't just solve their problem in 10 seconds or 15 seconds. I mean,
no, but these are great questions, and these are great awareness pieces for people, because, Anne Marie, this is new, right? It's new to people, and so it's great for people to ask these kinds of questions, because it's good for them to learn that there's just so much out there, and there is so much out there. I mean, we teach other dentists this concept through the Wellness Dentistry Network. And in the Wellness Dentistry Network, we have 23 different modules of educational concerns for people: cavities, environmental damage to the teeth, sleep apnea, oral cancer, and then metabolic syndrome, heart disease, diabetes, all these different areas, pollutants, heavy metal toxicity, all these different areas that yeast and molds is a huge issue. And so we have a great opportunity to really help people. And it's just good right now for us to get to the public and let's scratch the surface as to what we can do.
Oh, I think it's great what you're doing, but the bigger part of what's great is the Wellness Dentistry Network, because it's not just you as one man in America. It's not going to change the whole country or the whole world, but we've got to get this information out. And it's incumbent upon the dentists, if they know that what exists in your mouth, what exists in your oral cavity is responsible for these deadly diseases, pancreatic cancer, ovarian cancer, lung cancer. I mean, the list goes on.
Yeah.
And no one knows. I mean, there's a handful of people that know about it.
I would love for people to ask their dentists to join the Wellness Dentistry Network. Let us help teach them. But we have about 165 offices around the world. We're in New Zealand. We're in Spain, Italy. We're in Canada. We're all over the world, and we're in the infancy of trying to teach people these concepts. It's very, very important. Also, we have, I'm a member of the American Academy of Oral Systemic Health. That's another academy that is teaching dentists and trying to teach dentists about these health and wellness concepts. So it's so super important.
I was just thinking, you're talking about a couple of hundred dentists that already belong to the Wellness Dentistry Network. I'm just thinking there's probably about 500 or 600 dentists around here that should join.
There's no question. Well, every dentist, I mean, I think it should become a hallmark in every dental practice. Who doesn't want a healthy patient with a beautiful smile? I mean, that's what
Because what they want is the beautiful smile, not necessarily. They can be dying of heart attack, but as long as your smile looks good and you've got your veneers on and you've got all the fancy smile, that's about all they're thinking about when you walk in. I've never heard of anybody among my coterie of friends, and they're all educated, so they've never heard about it.
Well,
They
let me
just
tell
never
you.
heard about it.
Let me tell you, if you want to experience joy in practice, start talking about health and wellness concepts and helping people be healthier. I mean, we can get the smile thing dialed in easy. Helping people be healthier is another concept, and it's a lot of joy for our team. It feels great in practice. It changes the whole dynamics of what it feels like in practice. You walk in our building, you'll feel the difference.
Oh, I don't doubt it. I mean, just going into practice like that, where you've got this access to this whole diagnostic model, where at least you're going to find out what you're at risk for, and then you're also acting like you're referring people out to the right doctors. So what more can you ask for?
Yeah.
Just everybody needs to know about it. That's all.
Well,
Problem is no one knows about it.
That's why we're here.
That's why we're here on WJR and Facebook. We go 1 minute to close. We have 1 minute when we go to the close. 1 minute left. Do you have any callers? You have one.
Instead of 36.
Welcome back to the last segment of this special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please give us a call at 800-859-0957. And repeating that number, 800-859-0957. We've had a lot of callers, and Ashley, you have another one.
Yes, we have Adam calling from Detroit. Adam, what's your question?
Hey, I guess I got a couple. It's a two-part question. Since you were on the thing about sleep apnea, I basically have tried it for about over 5 years. That was a while ago. I still had fatigue every day. My AHI was fantastic. I had polysomns look at it. It eventually just drove me nuts where I couldn't even do it anymore. So I gave up on that. And the other guy called in. I have the brain fog. I have the fatigue every single day. I don't know if it's just sleep apnea, but it's definitely debilitating. I can't even work. Other things that happen are, I'll be sleeping, and sometimes I'll wake up and realize I was biting my tongue. Or sometimes I'll be falling asleep and I'll just get like a stabbing sharp pain in my tongue, and I didn't bite it at all, and it's just really quick and it goes away. I was actually wondering I don't know if this is your wheelhouse or not, but I'm just wondering if the only final resort is maxillomandibular advancement, like where they break my jaw. I don't know what else to do.
Yeah.
I'm just wondering if you have thoughts on that.
I do have some thoughts on that. And what I think we need to do is get you to a sleep neurologist, and we have in part of our wellness dentistry network, we have a sleep neurologist in Texas that we can work through the mail, through the internet with. And what I'd love to invite you to do, because your problem and this call is very complex. So what I'd love for you to do is call the office, let us hook you up with a sleep neurologist in Texas, and let him take it from there. He's an expert in neurology, and when you talk about tongue problems and nerve problems, that's beyond the scope in our general practice. So let's get you to somebody who can help you.
That's pretty amazing. The doctors in Texas?
The doctors, we have through the Wellness Dentistry Network, we have a whole piece called Partners in Health, and we have people all over the world that can help folks with other problems if they're not geographically located near us. So that's an important thing, and I founded the Wellness Dentistry Network, and I have a team of people that help me manage that. And we talked about the 165 offices, but we have plenty of physicians and specialists around the country that we can refer people to that need special help, like our last caller.
I didn't even know there was such a thing as a sleep neurologist, so I dare say that probably no one else knows. And the fact that the one that you found, who is obviously an expert and one that you rely on very well, is all the way in Texas. I mean, who knew that this subcategory of health even existed, or medical care?
Well, it's interesting, Anne-Marie, but in the world of COVID, some of the teledentistry and telemedicine regulations were relaxed a little bit. And so we have people that are in remote parts of the country that can help our patients, usually virtually, and they can mail different tests through them. They can make different references to tests that they can do through the mail. They don't have to be geographically approximated in order to be serviced. So someone like your last caller has a complex problem, struggling, tried different things, hasn't been successful. That's frustrating. And so I would love to help him find an answer to that, but it's going to go outside of my wheelhouse of expertise, and I need to rely on other specialists that can help me.
It's what we call all the time on other radio shows the compartmentalization of medicine. I feel sorry for all the listeners and all the patients out there who have fallen through the cracks. They're going to their primary care physician. They get sent on to a cardiologist. They get sent out to an endocrinologist or whatever. And everybody's got their own little house that you walk in and out of. And there's no adjoining paths. And so many patients out there. That's why we have so many calls on these shows, because so many patients are lost and they've fallen in between the cracks.
Well, we'd love to help them connect the dots, and we have a pretty good resource, being that, I educate at the Coy Center in Seattle, Washington. That's a postgraduate continuum for dentists, and I'm exposed to hundreds of dentists a year from all over the world. And so it's a nice opportunity for us to network with people that I have confidence in that can help other people. And we'd love to be the conduit to help people do that.
I mean, it's a pretty amazing movement, this Wellness Dentistry Network. I mean, I think that every dentist should have been their training in dental school.
It'd be brilliant to bring the training into the dental school, but I gotta, in respect for how hard it is to fix the teeth and how much there is to learn in dental school in 4 years or 5 years' time, it's so hard. And this is really something that you have to pursue. They're starting to do more and more in dental schools, but it's just not possible to learn. I've been working on this for 15 years, so it takes a long time to get really competent. But for most dentists, you can do so much with your practice in just a short amount of time.
I'm just curious about what got you started on this path. I mean, because so many other dentists are just out there doing veneers and fixing teeth. And what was it that stimulated this initial interest that you got into this work and then decided to explode it all over the world by getting dentists to join you in this movement?
I guess I'm a little bit unique. I was fascinated by bugs. I was amazed by what kind of bugs live in the mouth. And when I heard there's over 700 or now over 1,500 different types of bugs that live in the mouth, I thought that's kind of cool. And but are they all healthy? And then when I found out that there's a big population of them that are very pathogenic and they cause problems all over your body, I really wanted to learn about that.
So are you able to separate the pathogens from the healthy oral bacteria?
Absolutely. We can identify the pathogens, and we can look at symptomology. We can look at what's going on in a patient's life, and we can gain a tremendous amount of information by looking at the oral microbiome. But remember, it's not just bacteria. It's bacteria, yeast, and viruses.
Sure.
So in our practice, we are very attuned to looking at all those things and making sure that people have the proper balance.
So obviously there's normal flora in the mouth. We all need a certain amount of microbes in order to take care of bodily functions, etc. But when you take a look at, these specimens and you identify in the mouth, here are the pathogens, here's the normal flora, you've got to separate the two. How long does this treatment take? What does you actually do? I guess that's my question.
Well, one of the things that we do is we do from both mechanical debridement, meaning get the, basically remove the bacteria by mechanical methods. We have some really cool tools. So we can use those tools in a painless way to remove the bacteria from around the teeth. And then we use other things to remove the bacteria from the tongue and the cheeks and the tonsils and other places where the bacteria grow in the mouth. But then, Anne-Marie, to your point, we also have to always be courteous to the gut. We have to be courteous to other areas that are going to fuel the mouth with harmful bacteria, or even to a source that could be contributing to the oral load or the abundance of bacteria that are in the mouth. So it's an assessment that we make, and once we make that assessment, our goal is to rebalance it to a state of health. And so we do that through mechanical methodology. We do it through antimicrobial rinses. This is why our first phone call was so critical about rinses and what oral rinse should I use. And, hydrogen peroxide, although I have no problem with it, it's just not strong enough if you have a big imbalance. So the idea is figure out what the problem is, figure out where the pathogens are, figure out how the body reacts to the pathogens, and help the patient customize a plan so they can not only, and for us to not only control and help control the microbial load, but also help the patient figure out what can they do in their life and their health. Better sleep, better nutrition, better hydration, a little bit of exercise, exposure to pollutants, all those types of things cause big problems for patients. We want to help them identify that and control it.
And amazing to think that it can prevent a heart attack and stroke and probably Alzheimer's. Well, unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on News Talk 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope you enjoyed this special show and that you become more informed about oral health and its impact on the major diseases of our time. Thank you for listening, and be well.